Menopause affects roughly half the population, yet most women report feeling abandoned by their doctors during this transition. Hot flashes, weight gain, mood shifts, brain fog, these aren't minor inconveniences, they're life-changing events. And yet the standard of care is often a one-off appointment with a general OB-GYN who spends 15 minutes and sends you home with a pamphlet. Hi, I'm Nancy Margrit, and this is The Practice Pulse, a show where we explore how health, wellness, longevity, and growth-focused businesses are building, operating, innovating, and scaling. Today, we're talking about a significant blind spot in healthcare and one entrepreneur's approach to filling it. Today's guest is Dr. Shannon Cothran. She is a board-certified OB-GYN and has additional certifications in menopause care. She spent 15 years in practice working with women across all life stages, but felt constrained by time and frustrated by the gaps in menopause support. Last year, she founded MenoStart, a 6-month concierge menopause program that integrates personalized medical care, fitness coaching, nutrition strategy, and community. We're talking about how she identified a market opportunity, built a team, and created a delivery model that doesn't feel like traditional healthcare. Dr. Shannon, thank you so much for being here and welcome.
That was a great introduction and very well, a great summary of what I've done. I love it. Thank you so much.
Good.
Yeah.
Well, thank you.
Yeah.
Awesome. Well, if you don't mind, why don't you tell us just a little bit about yourself and your journey and how you kind of ended up here and how you identified that gap that needed to be filled.
Well, like you mentioned, I was in private practice, which was about 50-50 obstetrics and gynecology for 15 years, raised 3 kids, built a practice, delivered babies, did, full scale GYN. Really was able to develop relationships with my patients, which was the joy for me, and kind of grew up with them. And so as I was getting, also in perimenopause myself into my mid and late 40s, had a lot of patients where we'd had babies at the same time and all of those things. And one of them asked me, like, who do we see for menopause care? And I was kind of surprised because I was like, me, like us, GY. And, she said she was at a book club with her friends and they were talking about it and how they just felt like there were so many questions, and that the annual exam, it wasn't really enough time to get into everything. And it was a light bulb moment for me because I realized that's totally true. When I saw people at this phase of life on my schedule, I would get a little anxious because I knew it was going to take more than 15 minutes and, I would get behind and we would both be stressed. And so, I tried to change how I practiced in that model for these people, people in this phase. But just with insurance-based care and everything and the constraints on our time, nobody was satisfied with that. I also have been working with a personal trainer for the last 10 years personally and have really changed how I thought about fitness and nutrition and moving my body and realizing how much doctors aren't trained in that part of wellness. We're very disease-based training and kind of started thinking more about how can I integrate health and wellness and fitness into my own practice, also taking care of midlife women in a better way. And then realize that I'm going to have to do something innovative outside of the traditional insurance-based practice and, in order to really combine it. And that's, started talking to my trainer and then we decided to go into business together.
That's awesome.
Yeah.
What an amazing story.
Thank you.
And you really identified a blind spot in medicine, right? Because we have our OB-GYNs and that's their focal point. But with this insurance-based model, they're really not given enough time to dedicate the needed time, effort, and energy to really prepare these women for what they're about to go through as they enter, perimenopause and then onto menopause.
And not even the time, but also the training. I trained 2004 to 2008 for residency, and I never heard the word perimenopause in that time. Menopause.
Really?
Yeah, never.
Wow.
And menopause, we did get some training, but most of it was how to manage postmenopausal bleeding, and kind of hot flashes. And then the WHI study was happening around that same time. And so, we just stopped giving HRT at that point, we being medical people. Although
Right.
I would still do it, but it was very much, lowest dose for the shortest amount of time, try to limit it to 5 years, nothing after 60, even if people were still symptomatic. So that was about the extent of our menopause training at that time, too. So it is a frontier in a care model, but also just how even gynecologists who are women's health experts think
Mhm.
about this phase of life.
Yeah, that's interesting that there's not even kind of that necessary education to assist these women, which, I mean, that's been a a string of a theme in our history in medicine is that we kind of tend to sideline women
Yes,
in general. So bringing some new things to the forefront as we start to dive more into some of the research around women and women's health, I think these things are going to pop up more and more where it's like, oh, we actually need specialized training in these areas. So it's amazing that you took the time to step away and really get that additional training so that you're really able to support women as they go through these core changes in their lives that really take up a big chunk of your life. You know, the perimenopause all the way through menopause is a pretty decent chunk of your life.
it's
Uh,
huge.
yeah.
And I think there's been a lot of negative feelings about menopause, kind of
Mhm.
as it's an end to our fertility and all of those things. And that has been therefore thought of as maybe an end to our value to society. And I think that is really shifting now with my people my age and the millennials, people a little bit younger than me.
Mhm.
We still have a lot to give. And these, next 4 decades of our life where we're in menopause can be really great. So kind of shifting that narrative too to this hopeful phase of valuing ourselves as women in a different way than just looking at us as moms, which is awesome. I
Mhm.
love that part of being a woman. But we have, we're more than that. And not every woman has a pregnancy, but every single woman will go through menopause. So it's even more universal than pregnancy and fertility. And so
Yeah.
it's kind of cool for me to be able to think about women in that way, even though, I am a woman and I've dedicated my life to women's health. It's a shift.
Yeah, it really is. I was reading an article by an anthropologist. This was months ago, but he was talking about or theorizing that the reason that women go through menopause and men don't go through a similar phase is that women actually are meant to go through menopause so that they stop doing the caretaking and they can actually pass on some of their knowledge
Wow. I love
than
that.
to the rest of the community and
Mhm.
group, which I thought was a really cool kind of theoretical
Yeah.
explanation of why do we have to go through this whole thing?
Yeah,
Because
that's
our bodies
fascinating.
shift in so many weird ways
Right.
to do different things to really, perpetuate our society and help us grow as a human race. But yeah, I thought that was interesting, and it's a big shift.
Yeah, it's fascinating. And when you think about brain fog, that's very distressing. It's very common in perimenopause where
Mhm.
kind of your cognitive ability goes down, but then it comes back up. And what they're finding is the brain is remodeling during this phase.
Wow.
I know it's amazing. And so it can be very distressing and confusing when you can't find a word and you don't feel
Mhm.
sharp, you don't feel like yourself. But I think giving a message of hope that this is a remodel, it's like you're about to turn into a butterfly kind of thing
Yeah.
can really help too and to validate what's happening, but to stress that this is a change that's going to be for good.
Mhm. I love that. I
Yeah.
didn't I didn't realize that. I love, brain health stuff is always
What we're
fascinating to me,
learning
so
is amazing. But
yeah,
also if you think generationally, like your anthropology angle, people didn't live this long for many, many generations. So,
mhm.
and in your work in wellness and longevity, I'm sure you've come across, we were really thinking about lifespan as like how far of a number can we get to? But
Mhm.
now we're transitioning to how do we live well in this phase? Not just getting to 90, but the health span, not just lifespan. And that's really a new phenomenon for men and women, just humans of living this long and kind of optimizing health. So I think it's an exciting time too, but that's why we don't have a lot of experience as humans in this. What does it mean to be in menopause for 4 decades? Um,
Mhm.
it's new.
It is new, and I love how you phrase that because we are trying to, extend our health span. We wanna get more life out of our years, not just more years out of our life.
Right.
And that's what I think is so powerful about the work that you're doing because you're really helping that transition, helping you get the life out of those years
Yes.
and stop feeling so overwhelmed by what's going on and kind of clueless. So I think when you have a guide that's helping you navigate that and really giving you some coping skills to relieve some of that pressure, it can be super helpful. So let's talk a little bit about a typical client experience of yours. So walk me through what that experience looks like over 6 months and how your program is structured.
So I really want to I know the word holistic is kind of overused, but it's what
Mhm.
I'm trying to do, the whole person. A lot of traditional medicine is focused on body parts and each organ kind of has its own specialist and no one's really looking at the whole body. But this phase of life has, if there's any pause in it, is that we need to realize it affects the whole body. It's not just the period. It's not just a hot flash. It's not just joint pain. It's all connected and it really
Mhm.
means that we need a holistic approach. So that's where we combine the fitness and nutrition and the medicine. My part is the medical part, obviously, and it's very consultative, not a one protocol approach for each person. So we start with a 60-minute visit, really get into your history, your family history, what you've done in the past, what lab work, what medicines, how do you feel about medicine, all of those things, kind of the whole person. And then through that we can identify what's the biggest pain point that you're going through right now, strategize a plan, if it's therapeutics or whatever it ends up being. Do you need imaging, whatever? And then following up with me in 4 to 6 weeks, with another appointment. I do have GYN exam room. I can do exams, pap smears, all of that as well. Well, woman
Mhm.
care, preventative care. And then we offer one on one personal training. We have some group exercise classes as well, nutrition consult to take care of that part and the wellness component, to combine
Mhm.
wellness and medicine together instead of having them fighting. And I'm doing probably quarterly some community events. We just did a Meno hike. It's optional. Everybody's busy, of
That's
course.
cool.
But community is really important for cognitive health and mental health, obviously, and trying to do something active and having a place where you're not just Dr. Cothran or Tommy's mom, where you could just be yourself and connect with other people going through this really is therapeutic and great for me too, to be able to do
Mhm.
that. So that's what you get in the 6 months.
Awesome.
Yeah.
That sounds like a very comprehensive program,
Yeah.
and I'm sure is very helpful. So I do have a few follow-up questions to that. So do you offer a virtual program as well, or is this all in person?
Yeah, I have virtual. I can do phone call while you're, driving in traffic. I can do in person. I do have a, beautiful office, but I try to make it as, work for the person that what they need.
Right.
And since I'm not using insurance, I don't have to worry about billing. We just take care of that at the beginning with the membership fee, and then however you need to access us, that's what we try to do.
That's awesome. And then so are there women that maybe want to extend and do another
Yes.
6 months because they feel like they need that extra support?
Yeah.
Yeah.
And so we are developing some different programming to try to meet the need, since we're new and innovative. We've, kind of trying to figure out the best model for everybody. We have kind of an alumni model right now
Mhm.
if people still want to do preventative care and, continuing whatever medication plan we've done. But we'll probably extend to midlife health like a full concierge prescription or a subscription membership that people can do. And then so that's a work in progress, but yes, we do have people that have renewed and continue with us. So that's part of the business development that I'm working on. What's where to meet people in the best way.
Right. Yeah, most healthcare, feels transactional. You show up, you get advice, you leave.
Right.
But your model seems more designed for continuity. So with that in mind, like how does that change the possible outcomes that your patients are seeing that they wouldn't otherwise see?
Well, I think it changes it in that it's more of a partnership. Like I'm partnering with people on their health.
Mhm.
I'm in Northern Virginia, DC area, which is one of the most highly educated populations in the country. And, people are smart. And so I get to learn from my patients and they're learning from me. I'm not just dictating a protocol to them. And so it's very individualized as far as like how it comes out in their outcomes. But yeah, I mean I've only been 2 years. It'll be 2 years in
Mhm.
June, so I don't have any like 10-year data, to tell you. But I think it's going great. People are
Yeah.
we have some people that are triathletes and Ironman, and they're even getting a lot of benefit from our exercise program to people who have never lifted weights or done anything. And now they're really kind of committed to fitness in a new way, to sometimes getting people into different resources that they need and really help coordinating that if it's pelvic floor physical therapy or mental health services, really coordinating care as well for people, which can be really overwhelming. And then I think the HRT, the GLP-1s are really helping people in this phase in a lot of ways
Mhm.
that I'm excited to see the long-term effects. But you know as far as the short term, which I think about a year or 2, it's been very positive for everybody.
Yeah, it sounds like your approach is great because I do feel like in medicine there's often a divide between the patient and the doctor
Yes.
slash science, right? And so when you bring in like the actual patient experience, because human beings are so individualized, and what works for one person is not necessarily going to work for
Right.
another person. So as a doctor, if you're not pulling in that feedback to complete that feedback loop and pivoting as you need to pivot and shift to really accommodate the individual's needs for care, then you're not going to get nearly as far as you will when you incorporate that.
Yeah.
So I think that you're doing that is just beautiful. And I'm sure you're seeing, amazing outcomes
Yeah.
with just alone the thought of like not having to navigate this on your own and being able to tap into your, extensive background and knowledge and have an understanding of what's actually going on with your body. It's like once you can put a word to it and you understand what it is, it's so much easier to like digest and deal with when you're going through something like this. So I think that's great that you take that personalized approach and really taking the individual into account.
That's my hope, Nancy. I love how you put.
Yeah.
Thank you.
Good.
Yeah.
Yeah. I think it's great. I think what you're doing is amazing. So you brought is it Coach Delaney?
Yes.
So you brought Coach Delaney into this from the beginning, and a lot of practitioners kind of add fitness on the side, but you made that like one of your central offerings. What Tell us a little bit about why you made that choice up front to bring Coach Delaney in and
So
focus on that fitness.
he was my personal trainer for 10 years, and we've always talked and had great discussions about kind of health and wellness. And, one of the things with bone health and osteoporosis, I realized I was telling my patients almost daily, like to do weight bearing exercise for their bones. And I didn't even know what that meant. So I asked him, I was like, what's weight bearing exercise? Like, does yoga count? And so we had this whole like conversation about what that is. And I was like, wow, we could really like combine our knowledge to make it such a different experience for people. And I think the fitness industry, they have filled a hole that doctors have left open, where people want information, they want to feel good, they want to be strong and healthy. And, we can't, I just say weight bearing exercise, see you next year without any details of what that means. And I don't even know. That's not really helping. So then they've really gotten into kind of filling that gap,
Mhm.
but they don't have the same medical knowledge and training that I have, and so sometimes I worry that that advice maybe is going against some of the medical advice, it wasn't working together. So we actually talk, and then especially metabolism is a big thing in this phase, so we would talk a lot about that. Like, what do I tell my patients when they're telling me they're eating the same and gaining weight. And, there's so much advice
Mhm.
on different types of exercise. Like, what do I tell them while I'm doing my own, training? We're having these talks. So at first we thought maybe we should write a book
Mhm.
on kind of metabolism in menopause and, with a trainer and a doctor and what to do. And then neither of us are really that type. We're not like book writers. So
Mhm.
it kind of developed into, what if we just did something together where we can treat people, you know, holistically together and
Right.
combine our knowledge. And then he had a lot of midlife women clients anyway, and seemed to, um, for some reason, maybe it's because women just like people to tell them information, they kind of seek that out in a different way than men. I don't know. Midlife women maybe having time to do that versus different ages. So he had a lot of
Mhm.
clients in this age group anyway. And then, just kind of went from there.
That's
Yeah,
awesome. Yeah, I think it's so important that you're bringing that aspect in because having a fitness component in your life makes your life easy at any stage, right?
really every part
Easier.
of,
Yeah.
and there's even data. It's very interesting that hot flashes get better with exercise. Like, obviously joints and bone health and all of that makes sense. There's tons of data on mental health and exercise, and weight management and all of those
Mm,
things. But hot flashes doesn't make sense that it would get better with exercise, but it does. So,
yeah.
and there's no pill to replace that. You just have
No,
to do it.
to move.
And the biggest challenge, honestly, has been, and you'll appreciate this with your marketing background, is kind of convincing women that it's okay to invest in themselves.
Mhm.
And
Yeah.
so if it's part of the program, it's kind of easier. I had them separate, and a lot of people, well, I'm already doing stuff on my own. I have my Peloton or whatever, but if I can get them to try the one on one or the group class, you really do push yourself in a different way, and everybody can learn. So having it part of the program has kind of given people permission to do that, and it's really increased the access to that.
Yeah. It probably also increases some retention as well because you're seeing additional results when you're incorporating that fitness component and you just feel better. Like nothing replaces the endorphins you
Right.
get after a good workout. I mean,
And
that's
they're trying to
that's why
figure
I
out
run.
how to get
Yeah.
those into a pill, but they haven't done it. So
It's not gonna
we
happen.
got to keep, going on the treadmill or whatever.
We just gotta keep doing it. All right. Well, let's shift and talk a little bit about the business side. So, when you left a 15-year practice to launch MenoStart, what was your approach to building this client pipeline? And how do you reach women now that need you the most?
That's been the biggest learning curve for me as a physician. We're not really trained in this at all, this part. Luckily, I've had business advisors helping me, different, friends that have given advice. But kind of it's been a trial and error thing on how to reach people. I had a
Mhm.
5-month waiting list in private practice. I've been in the community a long time. So I just was kind of thinking, well, everyone knows me and they'll just come over to this model. But there's really been a lot of market education and telling people, why it's an advantage to them not to use insurance based care, and kind of figuring out, that they deserve this and all of those things. So it's been word of mouth, my old patients. I did some social media marketing, blogs, some magazines in the area. But the best kind of place where we're getting our patients is still word of mouth.
Mm.
And so that's a slow method, unfortunately, for me. But I think people just have to experience it, because it is so personal, it's hard to put on exactly what you're getting, until you
Mhm.
experience it. So that's been a learning something I'm still learning.
Right. Yeah. No, word of mouth is great, and it's something, especially when and you're still in your infancy, so when you're starting a business, that's the best way to kind of grow organically until you get to a place where you have those systems in place, and it's like, "Okay, now we can scale a little bit, while, figuring out how to do that in the right way so that you're still able to retain that client or patient doctor, relationship that you've worked so hard to manage." So I
Yeah.
think that's wonderful that you're starting off this way and keeping it, true to your goals to help these women. So running a concierge program means managing capacity carefully. So you
Nancy,
do
we
have
have
to
an
think about that
unstable
as you
connection.
scale. How do you think about scaling without losing the personalization that's central to your brand? She's gone. We'll just keep recording.
Yay. Sorry, Nancy. I
Hey,
don't
that's all right.
that was weird.
I was like, I just sent you an email just so
I
you had
saw
the
it
link
and I
again.
was like,
Okay.
I'm trying. And so actually that link worked because I tried to go back to the other link. Anyway,
Well,
here we
you're
are.
here now. So
Luckily,
that's good.
we do edit these things.
Yeah, I know. I
Yeah,
just kept recording because it'll automatically edit out silences anyway, and so we'll
perfect.
just come back and edit this part out. It'll be fine. So
All right. Yeah, my connection said unstable, but now it's not saying that anymore. So
good.
I
So maybe
don't
we're
know,
good now.
a weather thing or what, but
Okay.
anyway. Okay.
I'll re-ask that question.
Yes.
That way you're that way
I
you know what's
forget even
happening.
what we were saying.
Okay. All right. So you are running a concierge program, which means
Yes.
that you're managing capacity carefully. So how do you think
Yes.
about scaling without losing the personalization that's central to your brand?
I love that question. So we've been so focused on kind of getting to that capacity. Excuse me. We've been so focused on getting to that capacity that, sometimes it's overwhelming to think about scaling the next step. But of course you do in business. You are always thinking about the next, year, the next 5 years. And I think that and I've talked to a lot of business, people giving me advice and different questions that they have. And they're always concerned about, are we going to be able to find other physicians that would be willing to practice in this way? You know, like, is that the rate limiting step? Is kind of the talent pool? And honestly, no. I think the best news I have for anybody that's thinking about scaling or business is that physicians are not happy in the model that they're in. And if I can make this work and get to capacity, I think it would be very easy to find people who are motivated to take care of people in this way, want to practice in a different way, care about health and fitness, finding another, physician partner or employee is going to be the next, the way to make sure that the patient experience stays the same.
Mhm.
I've had a lot of residents that want to come to the clinic and shadow me and learn. Like I had mentioned when I was a resident, nobody was doing it,
Mhm.
talking about menopause or practicing this way. And the young doctors, they are hungry for this knowledge, and they want to hear about it and what's going on. So I think the next step in will be hiring, in order to
Right.
make this serve as many people as possible.
Okay, awesome. I think that that's important to bring
Mhm.
on that extra help that can really keep the patient doctor relationship alive. So that's great.
Yeah, and concierge medicine is really growing as well. It started
Mhm.
about 20 years ago, mainly primary care and dentists, mental health, a lot of different fields. It's standard. Gynecology and women's health hasn't traditionally been in that space, but it's starting to enter it, starting to grow. I think people are realizing kind of the limitations of what our system is giving them, and they want better care. Doctors want to provide better care, not have
Mhm.
so many restrictions. So I think that it's a good time to get into that model as well for everybody.
Yeah, I agree with that wholeheartedly. So as you've grown your practice over the last couple of years, What's been the biggest operational challenge since you've lost? Like maybe something that surprised you about actually running this versus planning it?
That's a great question. I think the greatest challenge has been outbound, just outbound and outreach and figuring out how to do that. As a professional woman, I was very successful in what I was doing, but kind of asking people for money and the sales part is not natural to me. So having to learn how to do that and be okay with that has been, something that I've really grown in
Mhm.
personally. And then operations, because just finding kind of an innovative thinker to implement all of these things has been a challenge. So I've done a lot of it myself and learned and grown in that way. And so, just figuring out the operations part on my own, I think has been really helpful when I'm ready to find a person to take that over and kind of run with what we built. I
Mhm.
understand it a lot better, which helps me define, what kind of role I'm looking for. So I think that was a personal challenge for me because it was out of my comfort zone. I never had to do that in private practice. But now that I've had to do it, even though it's been a little painful, I really understand what business operations means and what we need for the practice. So I can define kind of an HR position in a better way. So that's been the biggest challenge that was surprising to me. Which,
Yeah.
looking back, it shouldn't have been surprising. It makes, makes sense. But, I don't know, I think when you take a risk, you almost have to be, you know, a little cocky, a little like everything will work out, a little bit, maybe disillusioned on what the pain is gonna be and just
Mhm.
jump off that cliff and then kinda learn along the way. So,
Yeah. Yeah, and as you learn and build out those systems, like you said, it prepares you for the time when you're ready to hire someone
yeah,
because now you have the system built and you have that standard operating procedure that you can hand over to someone because you understand it more than
yes,
anyone. So you're able to educate the next person that comes in to help.
yeah.
Let's talk for just a second about the impact that you're seeing with your clients. We talked a little bit about this earlier, but what specifically changes for a woman who goes through your 6-month program versus someone who just gets standard gynecology care during menopause?
I think the best thing is really validating and kind of what you mentioned at the beginning of feeling left behind, by medicine in this phase. And I think showing people that you're not alone, there's people to help, there's hope. We don't have a lot of data, a lot of research, but it's happening. um, And kind of willing to have that discussion and that conversation has just brought a lot of peace to people.
Mhm. Yeah, I think that's a great point, and giving them really control over the
Right.
situation so that they're able to take steps because empowering women to really manage this phase in their lives can be super helpful.
Yeah. And my hope is that it will also help them with their social economic situations,
Mhm.
better performance at work, better performance in their, I hate to use the word performance, but better satisfaction in their family lives, being able to be a better daughter, a better mom, a better, partner, all of those things. It can help, it just that those benefits will continue,
Mhm.
past the 6 months.
Yeah, being able to show up and be present
Yeah,
in the relationships and the different scenarios, the different
exactly.
identity pieces that you have, right? Because
Yes.
we have so many different identity pieces when it comes to women because we are doing so much in terms of, outside workforce as well as childcare, oftentimes caring for a spouse, sometimes
Right.
caring for an elderly parent.
Yes.
There's just so much that goes into our lives and being able to be present in those areas as well as just to show up for yourself and it's like I always reference like on the airplane they are very like particular about if you're sitting next to a child you have to put your oxygen
Yes.
mask on first and so
Yes.
like this to me is like putting your
Putting on
oxygen
your
mask
own
on,
mask. Yes.
right?
I'm gonna put that on my
Yeah.
card. This is your
Yeah.
oxygen mask, people.
Yeah, you have to do
Yeah,
that. If you wanna show up for your family and your friends and at your
right.
workplace, you've got to put your own oxygen mask on first, or you won't be able to show up at full capacity. So, I
Yes. They
think
talk
that's
about this book when my in elementary schools about filling up your own cup,
Mhm.
and I forget the name of it, but it's more true, I think, for me now at 50 than it is for my, then 6-year-old to learn that.
Yeah. Sometimes the kids' books are the ones we need to
Right?
read the most
I was like, wow, that makes a lot of sense. Maybe the kindergarten teachers are giving that to us for
for
the moms.
ourselves. Yeah,
Yeah.
they're like they're like, "Hopefully the parents read this." That's great. So as you look back to the business, as you look at your business, like, kind of long term, is do you see this as staying like just this one location based practice long term, or is there a version of MenoStart that could be replicated elsewhere in other locations?
Yeah, that's the dream. I know I've talked to a lot of people about if it would be virtual only or, stay with having an office and in-person services. And I really feel like, that third space and having a place to go, is part of my dream with this. So I'd like it to stay as a option, to have different offices in different markets. So that would be my dream to kind of replicate what we're doing here and have different offices in different places. I would like to see this as different offices in different markets, kind of replicating what we're doing here, having a place where people can go. And, that's really exciting for me to think about. I have a friend in Boston who's interested, one of the people I trained with, so already talking to different physicians that I know and, you know, very exciting.
Mhm. That's awesome.
Yeah.
Yeah, that's exciting when you get to that point where it's like, okay, we need to really start systematizing things because we're going to
Right.
expand and have that kind of clinic in a box ready to go. So, one more question before we head into the lightning round and close out. So, what would you want for other practitioners, whether it's OB-GYNs or primary care doctors or wellness coaches? What do you want them to understand about menopause that might change how they work with their own patients?
I like that question. I would say the biggest thing is that sometimes it takes some trial and error to figure out the best solution, and then it's not just going to be one thing for each person. It's not like, hey, here's a 45-year-old protocol and now you're a 50-year-old protocol. And so if you're going to do this, schedule the follow up before they ask for it. Just, realize that it's going to be a trial and error. If you tell people that, they're going to trust you better.
That's great. All right, so this is the lightning round.
Okay.
So these are short questions, short answers, and then we'll close out. So only 4 questions.
Okay.
All right, what is one myth about menopause that you would like to eliminate forever?
That it's the end.
Hmm, that's a good one. What habit or mindset helps you the most to keep grounded when things get kind of rough or sticky?
Communicating with people that I love.
It's a really good one. It is. I've not heard that one yet, so I like
Okay.
that.
Yeah.
All right, what gives you hope about the future of menopause care?
I think the questions being asked right now are great and they're going to help us find answers.
Hmm. That's true. The more we ask, the more we learn and the more we can progress.
Right.
So that's a great answer. Okay, and then this last one's really easy. So where can listeners find you and learn more about MenoStart?
Yes. So my website is menostart.com, MENO dash STRSTART.com. One of my friends said the dash is for hot flash. So that's the best way. And from there, there's a button to do a free 15-minute consult and get on my schedule and we can get started.
That's awesome. Okay, and
Yeah.
we'll include your website in
Thank
the
you.
show notes as well. So, Dr. Shannon, thank you so much for being on the show. I really appreciate how you've diagnosed the real
Yeah.
bottleneck. It's not just time and energy, it's really a clinical knowledge as well and just structure in and of itself to be able to care for women during this phase in their lives. So that insight changes how practitioners think about their own constraints, and I think it also changes how women think about their care as they move into this phase and seek out more help and more support to really help them navigate this kind of difficult time for some people, very difficult time. So thank you so much for taking the
Thank you.
time, and really appreciate you being here. So, to our listeners, if you enjoyed this podcast, please like and subscribe to our podcast for more information about different wellness clinics coming about or different innovations in the health and wellness space. We'd love to see you on the show again. And we will also include in the show notes a link to Shannon's website. And we'd love for you to connect with her if you're on, stepping into some perimenopause or menopausal symptoms. I know she could help. So innovation creates possibility, implementation turns it into growth, and we will see you next time.